Hi, this is Bob Lightfoot coming to you from the offices of Reinhard Berner Van Duren here in Madison, Wisconsin, with another coronavirus update, this one specifically for long-term care providers. Today's Tuesday, March 17th, and at 1 o'clock this afternoon, CDC conducted an online webinar specific to long-term care facilities. What I'd like to do is go over some of the high points of that webinar for you. That lasted about an hour with a question and answer period. But CDC gave its specific recommendations for long-term care facilities applicable for assisted living facilities as well. There was a little background information. First of all, they stressed once again that social distancing is essential in stopping the spread, the community spread of COVID-19 virus. No more than 10 people are advised to be gathered together. And in fact, I just saw a bulletin from Wisconsin Health News come across my desk within the last hour that Governor Evers here in Wisconsin is restricting gatherings of 10 or more people. It was 50, now it's down to 10. That's effective 5 p.m. today. In addition, he is closing all the bars and restaurants in the state of Wisconsin except for carry-out and delivery, and encourages everyone that does not have to be anywhere to stay home. So let's continue with the CDC's webinar. First of all, there's much information to be found at cdc.gov/COVID-19. That is where this information will be found. There's also a replay of the 1 p.m. Seminar from today. So be sure, if you have the time, it's about an hour. That includes a number of questions that were asked. So let's go over some of the high points of the recommendations themselves. So for long-term care, what they're emphasizing is education of staff on the signs and symptoms of coronavirus. They wanted to highlight that not everyone's going to have a fever or all the symptoms. In fact, some people have the virus and are even asymptomatic. Early symptoms in the elderly may be non-obvious type symptoms like confusion or malaise, so be on the lookout for those symptoms. Be sure that you're checking your residents more frequently. You're going to especially check them on admission for symptoms and do a set of vital signs. And they recommended adding pulse oximetry to vital signs, and they also are now recommending for long-term care and assisted living facilities to monitor temperature and pulse oximetry and other vital signs daily. And if someone develops symptoms of respiratory type infection of any kind, or is known to be infected with coronavirus, they are then recommending that vital signs be taken twice daily. So be aware of increase in temp, increase in heart rate, and again, follow these vital sign recommendations. CDC did say that these symptoms can develop very quickly, especially the respiratory symptoms. So it can either be slow developing or it can develop rather quickly. They did emphasize that this might be a good time to review all residents' healthcare powers of attorney and guardians and end-of-life decisions. If they're unknown, get those clarified at this time. Certainly not to panic residents, but it'd be best to know now what those wishes are in case someone were to become symptomatic or extremely ill. In terms of the management and treatment of coronavirus, they did highly recommend avoiding steroid medication. Now, you may want to discuss this if you have a resident on corticosteroid medications. You may want to discuss that with the resident's personal physician to see if they would recommend continuing that or if they can be taken off. They did want people to know there are trials underway currently for certain medications to treat coronavirus. But there's not enough data, and they are not recommending any medications at this point for use even though there are some being tested. The strategies that they are highlighting to prevent coronavirus spread or getting coronavirus in long-term care and assisted living facilities very much mimics what Wisconsin advised through their DPH memo on Friday, this past Friday. At the end of this, I'm going to give you some links to additional information, and it'll include a link to that Wisconsin Department of Health memo that came out of Wisconsin DHS on Friday. It'll include all this information, as you will be able to find it on the CDC website, and I have a link there for you to be able to find it more easily. So obviously the biggest issue that came up in a lot of questions was visitation. Visitation absolutely has to be restricted. There is no question about that, in conjunction with what I heard Friday and with what I heard from CDC today. All visitors have to be restricted except for only essential personnel, and that would be staff and any ancillary services that are essential, and I'll go through that in just a minute here. They encourage signage outside the facility so that people are advised that they will be tested when they come in, and again, stressed several times, no ill person should enter any nursing home or assisted living facility in the country. Next is to emphasize communication with families. Make sure that they understand why you're doing what you're doing. Offer alternatives to communication if you can, such as phone or videos to connect. Maybe set up a hotline to consistently provide information for families and even for residents. So again, when looking at restrictions, include healthcare providers in those restrictions if you need to. So any ancillary healthcare providers, you're going to want to strategize this. Create a list of services that must be provided in your facilities. Provide a list of services that can be delayed or that can be stopped, and then educate everyone on those. I know I have had questions coming in about restrictions of, for instance, hospice workers, and so if that's considered to be an essential service to residents, then you're going to want to obviously screen those people every time they come in, and then educate your own staff on the kind of measures that you're going to take, and continue to educate both your staff and any ancillary healthcare providers and visitors. Practice social distancing in long-term care facilities and assisted living facilities. What that means is to cancel activities, cancel group activities. You can continue individual activities. Make sure people are 6 feet apart, even in a dining room if you are doing dining. But the recommendation was to stop all communal dining in nursing homes and assisted living facilities. You want to actively monitor your healthcare providers and staff for signs and symptoms of fever and respiratory infection, and that has to be done every time they come to work. So every shift that they work, they must be tested for temperature and signs of respiratory infection. Implement infection prevention and control practices in the facility. So if staff becomes ill while they're at work, they must be sent home immediately, and they must put on a mask immediately as they're leaving the facility. So staff have to go home if they're ill and put on a mask. In addition, you are going to have the local healthcare department notified that a staff did go home sick. And in terms of other facilities, if you are transferring someone, for instance, to another facility or to a hospital, make sure that you give them advance notice that the person has possible or actual coronavirus infection or symptoms of the same. And do that prior to transferring them. The next questions or the next issues that came up were PPE. This is a big issue right now because it's clear from the CDC guidance today that there is a shortage of PPE in our country right now. They are asking you to inventory your PPE now and provide necessary supplies when you can. Reach out to your contacts. The big thing they're emphasizing right now, because of the shortage of PPE, is to preserve as much as possible PPE. Now, how do you do that, you may ask? They want you to prioritize gowns for any procedures that have the potential for an aerosol spray, like somebody coughing on you, for splash, for high contact resident activities such as dressing, bathing, showering, toileting, wound care, and device care. Those would only be the only instances where you would use PPE because of wanting to prioritize and conserve your PPE supply. They did say that extended use of mask would be okay, and extended use of eye protection would be okay for at least one shift, would be okay to use throughout the entire shift, but you may not conserve and reuse gowns, gloves, those types of PPE. Those have to be discarded immediately after use. And so their advice was to, if someone's fully gowned, gloved, eye protected, face masked, that they will get rid of their gloves and gown. They can then perform hand hygiene, and then they can continue to use their mask and their eye protection. And probably with the eye protection, it would be a good idea to try and sterilize that or clean that if possible. Then there were a number of questions that came up from folks in the audience during the CDC webinar. The first one was, what if there's no isolation room? CDC recommended and stated that it's not required for care of a coronavirus resident that they be in an isolation room, that a single person room was okay with a private bathroom, that a single room was okay. They even said under certain circumstances room sharing might be okay. And next, what if there is a suspected coronavirus resident in your nursing home or assisted living facility? Do you have to send them to the hospital? And the answer was only if they require transfer to the hospital because of their clinical status. So if someone has very mild symptoms, even though they're known to carry the coronavirus, have been tested and test positive, that's not a reason to have to transfer them to the hospital. What you're going to want to do is make sure that resident's room the door is closed, that staff use PPE, good health or hand hygiene, that the health department's notified, and then you will only send them to the hospital if they get worse. So monitoring is very important of their vital signs. If it's just mild, again, no need to hospitalize them. Next question was how to get the test for coronavirus. That would be through the State Department of Health Services or your particular lab vendor. PPE was brought up again, and again it was emphasized that the best approach right now is to conserve PPE as much as possible through the strategies I mentioned earlier. And then finally, preparedness. How do you prepare for getting coronavirus in your facility? There is a preparedness checklist on the CDC website. I'm going to give you that website here in just a moment, and then also that link to the CDC nursing home page. So I just wanted to, that was the CDC webinar from today, from Tuesday. Again, let me just emphasize what DHS on Friday recommended. Again, screening, restricting visitors, posting signs, including signs about hand hygiene and cough etiquette. Post these on the doors in the lobby areas. Provide hand hygiene and cough etiquette supplies at all entry locations to your facility. Communicate to your employees, to consumers, to residents. Designate an employee entrance, a specific employee entrance to be used so that not everyone is using the same entry for both staff and visitors. If employees have signs and symptoms of any respiratory infection, they should not work. and they should be sent home with a face mask, immediately stop work. You'll want to screen individuals, everyone, visitors included, before they enter your facility, and you should keep logs documenting the dates and times of screening evaluations if that should become necessary for use in the future. So we want to prevent the spread of coronavirus between facilities, and again, Wisconsin DHS recommended following the CDC guidelines. So that's what we learned today. It's pretty important information. It seems like we're getting closer to lockdown of the state of Wisconsin. We're almost there, but I understand and have heard from both the Wisconsin Assisted Living Association and Leading Age Wisconsin that you all are doing a great job. So keep up the good work. Remember, the mortality rate's pretty high. If it would get in your facility with compromised individuals, it's much higher for the elderly than it is for younger folks, and younger folks have gotten through that. So let me give you, before I go, let me give you the websites here. So the first website is the Wisconsin DHS website, and underneath that you can see the web address for that memo from the state of Wisconsin that was issued on Friday. Underneath that is the CDC website. The CMS website. And they also have a memo that came out last week on some guidance materials that really mimics what the state of Wisconsin is doing. Underneath that is the CDC website. And that's the main website where you'll find specific long-term care facility guidance. There's a preparedness checklist. There's interim guidance for nursing homes. There's things facilities should be doing now. There's things to do with coronavirus in the community, with coronavirus in the facility. And finally, here's my email address and phone number. If you have any questions, feel free to call. I am working through this pandemic and happy to work with you on any questions you may have, either health-related or non-health related business. So with that, thank you for your attention. I'll be providing additional updates as additional updates become available. As you know, this is a fluid thing that's going on. Things are changing by the day, and I'm trying to provide you with the latest updates and information that's out there. So thank you, and we'll be talking to you soon. Stay safe.